Welcome to my Masters of Thanatology capstone project. My name is Maureen Butner, and I have created a visual portfolio of expressive arts interventions that spiritual care providers can utilize for their clients and their families in hospice care. In this video series, I am applying the lens of spiritual, hospice, and grief care onto expressive arts interventions. Despite being three entirely separate disciplines and areas of study, expressive arts, spiritual care, and hospice care intersect at the search for meaning, humanistic and holistic care, compassion for self and others, and the human drive for connection. Expressive arts serve as a powerful vehicle for self-exploration, post-traumatic growth, engaging with creativity, and reconciling emotional conflict, all of which speak to both the spiritual needs of the dying as well as the emotional grief work of dying itself. There is ample literature supporting the multi-layered benefits of art making, especially for those in hospice care. The various forms of expressive art, i.e., visual art, music, movement and dance, creative writing, and theater, all possess the ability to foster connection and facilitate self-expression, which can both personalize and humanize the medical journey. Further, art making dramatically reduces physiological and emotional distress and positively benefits self-esteem, which hospice care seeks to address as well. The more I researched, the more I became convinced that employing expressive arts therapies in spiritual care settings can do wonders for the experience of dying. All art that is created through these activities has the dual benefit of being a source of connection to the dying in the moment, as well as after their passing. Each art piece can be a legacy creation intended for loved ones to hold on to for years to come. The 5 expressive arts activities are geared towards a different facet of the dying experience and serve to meet the need for creativity and hope. In zine making, the activity guides participants through a life review, allowing for reminiscence about the full scope of one's life. In Roadmap for Transition, participants are offered space to construct a narrative of meaning within their transitional time. In Grief Exploration, participants are empowered to work with grief emotions in productive and cathartic ways. In Exploring Sound, participants are invited to create their own unique composition specific to them. In Greeting Yourself, participants are invited to explore their physicality without judgment to better cope with stress, pain, or loss. As spiritual care providers, you are already trained in the art of presence. You understand the foundational importance of providing patients with compassionate care that honors the innate dignity of each person and their individual as well as collective experience. Your job as a spiritual care provider offering these expressive arts interventions is to facilitate your patient or client's experience of becoming present with their own artistic, creative process, their emotions, and the interplay between the two. It is your role to create a compassionate, inclusive space for these artistic explorations, facilitate spiritual inquiry, and attend to any grief that may present itself. The activities serve as a foundation for finding or creating meaning within their personal experience. It is easy to layer on any faith-based perspectives or belief systems. Familiarize yourself with your client's beliefs prior to the activities. You will need to lead by example through creating your own art alongside your clients. You need to model open body language, curiosity about the client's experience, and open-ended questions to aid in moving through any blocks or resistance. Draw upon your skills and compassion to gently guide your client into deeper investigation of themselves. Remember the value of silence, space, and time in processing the raw emotions of grief and dying. Explain to your client that making art is about the process of creating instead of the product itself. Encourage any kind of expression. This is a space to trust your instincts and follow curiosity. Empower agency through allowing clients to select their own materials through multiple mediums. Follow their lead as they create. Relaxing music in the background can aid in allowing the process of creativity to unfold. Leave ample time for each activity to be completed, 30 to 40 minutes minimum if possible. For assessment, you want to avoid engaging in critique. Rather, engage the client in the process of observing their art and describing their process once they are complete. Open-ended questions like, what was creating your art like for you? Or, what does this piece mean to you? Can be a great way to get conversation started. Reflect back to your clients what they have expressed. Take note of any need for community or additional resources that they might cite. Applaud them for engaging in the activity and thank them for sharing it with you. Follow up on any spiritual needs that were expressed or articulated in their art.